I think it's not a one-size-fits-all. We are all individuals, and so for me, in my role in the organisation, it's having a range of support that colleagues can access that works for them and that can support them in the way that they feel that as though they need to be supported. The work we do is all about health, so we provide services to ensure that healthcare, innovation and research is meaningful. We want people to come into work, to be themselves and to thrive and really reduce the stigma around talking about mental health, but any other health issues.
For me personally, I've struggled with depression and anxiety over the years, and it's had a really significant impact on who I am as a person. And I found through sharing my story and sharing my vulnerability that I find that I'm not alone in suffering with this. There are so many people out there who deal with these kind of situations and illnesses at some point in their life.
So it made real sense for us to use the Mind Workplace Wellbeing Index because it's underpinned by evidence, and we like evidence here, and so we are able to use this tool and we're able to track our progress against it. We knew that we wanted to do more, and that's why we reached out to Mind about 5 years ago.
Employee wellbeing and inclusivity is a real priority here. I really feel encouraged and supported and seen, and I'm able to bring my own unique perspective and experience to my work.
I've observed the real people-first approach, not just in terms of what we say, but how we behave. And I think that is kind of the real test of some of those policies. Are people living and breathing it, or is it just something that we talk about? And I observe here that it genuinely is part of how we act on a day-to-day basis.
There's very much a lot of conversation at the moment about organisations implementing EDI in a tokenistic way, but I've been part of conversations with colleagues where I can feel there is a real genuine passion to create an inclusive workplace.
I've just been able to talk to people about my experience, and they've all been very supportive, so I felt like I haven't had to hide. I think if I didn't feel as comfortable with the people, I may have had to have hidden that.
Feeling supported in terms of my well-being at work gives me the confidence to do my job to the best of my ability. The ability to be able to talk openly about mental health issues is something that's really encouraged, and as a senior manager, not only do I feel comfortable talking openly about my experiences, but also feel that I have a responsibility to be seen to be saying that sometimes it's okay not to be okay.
So for organisations that are thinking about using the index, we would thoroughly recommend it. It's been well received by our colleagues. We know it supports recruitment and retention, and it's something that we're really committed to continuing with.